Jeez, is that the dog? Oh, wait. Puppies. The dogs. Welcome to another JIA video. Today we have a special guest. Grayson is actually going to be answering questions about his own condition.
Welcome to uveitis Q&A.
Well, you wanted to do this interview, yes? You wanted to talk about your condition?
Yes.
I have your permission to put you on camera and put you on YouTube and all that, eh?
Yes.
Good. Thank you for doing this.
My name is Grayson, and I have a disease, and obviously we're going to be talking about this disease today. We're going to ask questions, and I'm going to give the answers.
Do you want to talk about how old you are, what grade you're in?
Yes, I am 8 years old, about to turn 9 in 5 days.
4 days, 5 days?
And I'm in 3rd grade.
So the first question I have for you, Grayson, is what is your condition called?
Uveitis, as I said earlier. Uveitis Q&A.
Uveitis Q&A. You know, of course, that uveitis is only a portion of the condition that you have. Your condition is also actually called juvenile idiopathic arthritis, or JIA.
Okay.
Do you remember how you originally came to the diagnosis? Do you remember? It was 2.5 years ago.
No.
Do you remember what we first went to the doctor with?
I think we got ice cream after, but I don't know what we went with.
We got ice cream after. Is that the part you remember? That's cute. Do you remember you had pain in your knee?
Oh, yes.
Yes.
Pain in my knee.
Well, it was so long ago and it was recovered so well that you don't even really remember, huh? So you have two separate issues that happen right now. You have a problem in your knee and you have problems in your eyes. Which would you say is the most prevalent issue?
My knee, because it hurts. I barely even notice anything. All I notice is a change in vision, obviously. Not even pain.
Oh, in your eyes, you mean?
Yes.
You don't notice pain?
Nope.
Yeah, that's one of the things about your condition is that there's not really any
Nerves to do the job.
Yeah, I don't know. I did read that a lot of times when kids have, so with JIA, only about 20% of children also have uveitis. So about 1/5 of kids who have JIA, the knee problem, also have the eye problem. Mm-hmm. So it's kind of unfortunate you were one of the few that happens to have that issue.
I'm also one of the few who happens to be left-handed.
Oh, and you're left-handed.
That's part of 5% of the population.
That's what?
That's part of 5% of the population.
Only 5% of the population. So what is the percentage of people who have both JIA and uveitis and are lefties?
Well, if we add the two,
I think we'd have to multiply.
no, we'd probably have to divide. Because if we're going downwards, we wouldn't do a percentage. Because both of these are both rare things, so it wouldn't go up in percentage. It would
Right.
go down.
Right.
So
It would go down, but when you multiply percentages, it actually does break things up into smaller pieces. All right, so you have this condition called uveitis. That is the most prevalent issue. That is the one that we really think about a lot today. It is completely invisible and it's not uncomfortable for you, huh?
Nope.
Do you remember all of the treatments you've had through the years? It's been 2.5 years now. Do you remember various things that we had to do?
Well, I know we took a big pill, then we took small pills, then before all that we took pills crushed up into yogurt.
Yeah, pills.
Pills, and pills.
Yeah, lots of pills.
And then we moved on to shots.
Do you remember eye drops?
Oh, yes, I do remember eye drops.
We did eye drops for a while.
Eye drop.
And of all these things, of the pills, the eye drops, and the shots that we're still doing to this day, what's the worst?
Pills.
Really, the pills are worse than injections? Yeah, you could not tolerate those pills after a while, huh?
I don't like the idea of putting something. I don't know what I don't like about it. I just don't like it. but part of the reason is my mouth is so used to chewing stuff that I'm used to, that I want to chew it, but I can't because that's not what you're supposed to do.
Mm-hmm. Here's some, you're a fact person. I have some facts for you.
Okay.
Uveitis is the third leading cause of blindness in the United States. It's after macular degeneration and retinopathy problems, retina problems that are associated with diabetes. And then uveitis is third.
Well, wouldn't it first be like something happening to your eye outside of like internal problems?
I think maybe those are rare. I've seen this statistic over and over again. Uveitis is the third leading cause of blindness, at least in the United States. And sometimes it's not total blindness, but it's visual difficulties. Your vision starts to get worse. However, the treatments are so good now, and thankfully you are tolerant of injections because it's really important that you keep getting them because it seems to be really, really working on you. A lot of the symptoms have gone away really completely because you're able to tolerate having these things injected. So we're all grateful that you're able to tolerate those kind of treatments. You have a number of specialists that you meet with on a regular basis. Is there anything you like about meeting with them? Do you like your specialists? Dr. Stolberg is what we call a pediatric rheumatologist, and he takes care of your knees and makes sure that you get all the medicine that you need. So what do you think about Dr. Stolberg? Is he nice?
Yeah, he's nice.
It's pretty fun.
Yeah.
And then there's Dr. Copleen. She takes care of your eyes and makes sure that your eyes are clear, and we meet with her on a regular basis. Is she nice?
Yeah, she's very nice.
Very smart. These people are very smart, aren't they?
Yes, well, what do you expect from like a professional eye person?
And somebody who works with kids. They should be nice, right?
Yes.
One of the things I've noticed that I've really appreciated about all of the different specialists, these are the two main specialists, but you've met with many, many different doctors and specialists through the years. And one of the things that I've noticed is that people who are used to working with kids tend to be really, really patient and kind. And I'm so grateful for that. They're really, I've learned a lot about taking care of you from them. The idea that you kind of have to be firm in taking care of children, but you also really have to be concerned about their comfort and their level of pain and things like that. And so I've really appreciated seeing that side of pediatric specialists. I think they really specialize in making sure children are comfortable. Think about all the things that they fuss over you when you get a blood draw. They're always asking if you're comfortable, if there's other things they can do for you, if they can give you spray to help numb the area, if they can use the buzzy to help, vibrate the area to make it more comfortable.
Fun fact.
Yes.
If you cough while getting a shot, it hurts less.
If you what?
Cough while getting a shot, it hurts less.
Have you tried that?
No.
And then I really had to think about how to take care of you because I've had to give you some eye drops that are uncomfortable and, had you take pills that you hated. And of course the injections that we're still doing 5 times a month still. I've really had to think about how to be with you in those cases because I don't think it would work if I just kind of jumped out at you and said, hey, we're getting a shot now. We have to kind of work up to it. We have to talk about it every day ahead of time. We have to schedule a time. I have to give you the control over when I'm going to give you the shot, and I want to give you some control over that stuff. So it's taught me a lot about thinking about how to interact with my own child. What do you think about the fact that I have to give you injections instead of you going to the doctor to get injections, for example?
They're both just as good, to be honest.
Okay. Is it better to be at home and comfortable in bed, watching your iPad, playing your video games?
Yes.
That's better because you don't have to think about it as much, maybe?
Yeah.
You can distract yourself.
But at the hospital, they have more treatments to help.
That's true. They have more things in place.
things in place for actually this specific topic.
Yeah, like distractions and stuff, huh? Well, do you have anything else to say about your condition? Did you have any questions for me?
Well, what do you think about this?
Well, I have learned a lot about autoimmune diseases in general. I've learned a lot about your conditions, and I'm thankful that that I'm able to understand what's happening with you. I'm really grateful because the Humira that you get, which has been so effective, it's only been okayed for treatment of your uveitis since 2016. So you started using it in 2019, and the FDA only okayed it for treatment in 2016. So before that, you would have not been able to get such a good treatment. So I'm really grateful that we have extremely strong medicines now that can keep.
And we're grateful that we actually live in this time where they actually have things to defend off medicine.
That's right. Because in the old days, if you had uveitis, you'd have to be on steroid eye drops for a long time. And those didn't really work. They weren't particularly effective for you. They would kind of go up and down, like you'd keep on getting symptoms back and things like that. So, is there anything good about having these conditions, in your opinion?
It's good that I get 30 minutes extra of iPad.
That's true. Every time you have to get an injection, you get 30 minutes extra electronics time.
Mm-hmm.
And when we have to go see a specialist, a lot of times it's kind of a long road trip, so you sometimes have to take the day off of school.
Yeah.
And we usually go and get ice cream or some kind of a treat.
Yes.
So those are good things. I like spending time with you on those days. I've definitely gotten to know you in a different way than I would ever have, other than if this had come into our lives. Did you have any other things to say about your eyes, about your knees, about the treatments, about your specialists?
No, not really.
Do you have any words of wisdom for any other kids who might just be starting on this journey?
Do it. It's fine. Just do it.
All right, good job, buddy. Thank you.
I mean, it's not like you really have a choice whether to do it or not.
That's about it.
Yeah.
Thank you for your time. I love you.
Me too. Why do you keep this in my hair?
Because I'm hair and makeup as well as the interviewer. I'm doing all of the things.
I feel like I'm in the doctor's office with a big light pointing at me and them asking me questions about my disease.